Welcome back to our series on avoiding erectile dysfunction. Now, let's delve into actionable strategies for prevention and management, starting with crucial lifestyle modifications that can significantly improve your erectile health by enhancing blood flow and overall vitality. Regular cardiovascular exercise, such as brisk walking for 30 minutes, jogging in the park, or swimming laps, is vital for improving blood flow throughout your body, including to the penis, which is essential for achieving and maintaining erections. Aim for at least 30 minutes of moderate intensity exercise, like cycling along scenic routes, most days of the week to support overall vascular health and reduce the risk of conditions linked to ED. Maintaining a healthy weight through balanced habits is another key factor, as obesity can contribute to conditions like type 2 diabetes and heart disease, both of which are strongly linked to erectile dysfunction by impairing circulation. Adopting a heart-healthy diet, such as the Mediterranean diet, which is rich in fresh fruits, colorful vegetables, whole grains like oats and quinoa, and healthy fats from olive oil and nuts, can protect your blood vessels and promote better endothelial function. Quitting smoking is paramount for your vascular health, as nicotine not only constricts blood vessels, but also damages their inner lining over time, severely impairing blood flow to the penis and exacerbating ED symptoms. Limiting alcohol consumption to no more than 1 or 2 drinks per day is also important, as excessive drinking can temporarily reduce erectile function through dehydration and contribute to long-term vascular damage affecting sexual performance. Effectively managing chronic conditions like high blood pressure through medication and diet, high cholesterol with statins if needed, and diabetes via blood sugar control is crucial, as these directly impact vascular health and penile blood flow. Regular checkups with your doctor, such as annual physicals, and strict adherence to prescribed treatments like antihypertensives or insulin can help keep these conditions under control and mitigate their negative effects on erectile function. Prioritizing sufficient, quality sleep, aiming for 7 to 9 hours per night, is often overlooked but essential for hormonal balance, including testosterone production and overall well-being, both of which greatly influence sexual health in men over 40. Additionally, staying sexually active through regular intimacy can help maintain penile health by promoting consistent blood flow to the area, keeping tissues responsive and reducing the likelihood of fibrosis. Beyond physical health, psychological factors like stress and anxiety play a significant role in ED for many men. Addressing these through targeted approaches can be just as impactful as lifestyle changes in restoring confidence and function. Managing stress and anxiety, particularly performance anxiety that creates a vicious cycle, is critical since chronic stress can disrupt hormone levels like cortisol and impair nervous system function necessary for arousal. Techniques like daily meditation for 10 minutes, deep breathing exercises such as 4-7-8 breathing, and spending time in nature like walking in a park can help reduce stress levels and improve mental resilience. Treating depression is also vital, as it can significantly impact libido and sexual function by altering brain chemistry. Seeking professional help from a therapist or a psychiatrist for therapy or medication is a crucial step toward recovery. Improving relationship dynamics through open communication about concerns and possibly couples counseling can alleviate relationship-related stress that contributes to ED, fostering a supportive environment for intimacy. Sometimes, even with optimal lifestyle and psychological strategies, additional support is needed. In such cases, medical treatments offer effective, evidence-based solutions tailored to individual needs. Oral medications, known as PDE5 inhibitors like sildenafil or tadalafil, are often the first line of treatment, working by relaxing blood vessels and increasing blood flow to the penis during sexual stimulation. Other options include vacuum-assisted erection devices that create a vacuum to draw blood into the penis, as well as penile injections of alprostadil or suppositories for direct vascular response. Testosterone therapy, through gels, patches, or injections, may be considered if blood tests reveal low testosterone levels as a contributing factor to ED, helping restore hormonal balance. For severe cases where other treatments fail, surgical options like inflatable or malleable penile implants are available, providing a reliable and permanent solution with high satisfaction rates. It is crucial to consult a healthcare provider, such as a urologist, for proper diagnosis through exams and tests, and to determine the most appropriate treatment plan for your specific situation and health profile. ED can be an early warning sign of underlying health issues like cardiovascular disease, so a thorough medical evaluation, including heart checks, is essential to address potential risks proactively. Your doctor can recommend tailored lifestyle changes like personalized exercise plans, medical treatments such as the right medication dosage, and psychological therapies like cognitive behavioral therapy to comprehensively address your needs. Remember, ED is a common and highly treatable condition affecting millions of men, and seeking help is a sign of strength and proactive self-care, not weakness, leading to better outcomes. By taking proactive steps today, such as implementing these strategies and working closely with your healthcare provider, you can improve your erectile health and enhance your overall quality of life significantly. Thank you for joining us for part 2 of our series on avoiding erectile dysfunction. Stay informed, take charge of your health, and remember that positive changes can make a real difference.